Thank you for choosing Duke Health for your healthcare needs. Hello, I'm Dr. Talisha Ramchal, a gastroenterologist at Duke Health. During this video, I will review the step-by-step instructions to complete your bowel prep. Your provider selected your colonoscopy prep based on your health history. A bowel prep removes the stool from your colon so your doctor can see the colon lining. Your prep is a 2-day GoLytely prep. GoLytely is a prescription laxative prep. You will pick up your prep from your preferred pharmacy. The prep items you will need to complete your bowel prep are 2 bottles of GoLytely, 2 flavored drink packets, for example, Crystal Light, 4 non-coated simethicone tablets, dose 125 milligrams, brand name Gas-X, 2 bisacodyl tablets, brand name Dulcolax. Examples of clear liquids include chicken, beef or vegan broth, gelatin, clear sodas, apple juice, and low-sugar sports drinks. Do not drink any clear liquids that are red or purple in color. Let's review each step in your prep. 2 weeks before your procedure. If you take medicines for diabetes or to thin your blood, talk to your provider about your medicines. You may need to stop taking these medicines before your colonoscopy. 7 days before your procedure. Stop taking iron pills and multivitamins with iron. Drink 1 extra glass of water every day until your procedure day. This will help your bowel prep. Remind your driver about your procedure date and time. 5 days before your procedure. Stop eating foods high in fiber like beans, vegetables, fruits, salads, nuts, or seeds. 2 days before your procedure. Do not eat any solid food for the entire day. Drink only clear liquids and your colonoscopy prep solution. Stop taking any fiber supplements such as Metamucil, Citracel, and Fiberol. In the morning, open 1 GoLytely bottle. Add cold water to the bottle up to the fill line. Add 1 packet of flavored drink mix to the bottle and shake well. Place the bottle in the refrigerator. At 5 p.m., begin drinking the prep solution. Use a straw and drink 1 glass of the prep every 10 minutes until the bottle is empty. If you feel nauseous or vomit, stop drinking the prep and wait 30 minutes and then start drinking it again. At 6 p.m., take 2 Dulcolax tablets with a large glass of water. You will want to stay near a bathroom. A few hours after drinking the GoLytely prep, you will start having many bowel movements. Your bowel movements will be liquid. Continue to drink clear fluids until you go to bed. 1 day before your procedure. Do not eat any solid food for the entire day. Drink only clear liquids and the prep solution. In the morning, open the second GoLytely bottle. Add cold water to the bottle to the fill line. Add 1 packet of flavored drink mix to the bottle and shake well. Place the bottle in the refrigerator. At 5 p.m., begin drinking the prep solution. Use a straw and drink 1 glass of the prep every 10 minutes until only a quarter of the solution is left. Put the bottle back in the refrigerator. At 6 p.m., take 2 simethicone tablets with a glass of water. Continue to drink clear fluids until you go to bed. Review your arrival time for your procedure. Remind your driver about your procedure time and location. On your procedure day, do not eat solid foods until after your colonoscopy. Continue drinking clear liquids. 5 hours before your scheduled procedure, drink the rest of the GoLytely solution. 4 hours before your procedure, take 2 simethicone tablets and then stop drinking all fluids. Follow your provider's instructions about your morning medicines. Take your medicines with a sip of water. 2 hours before your procedure, your bowel movements should be clear green or yellow. If you're still having solid or brown stool, please call Duke GI and speak to a nurse. Keys to a successful colonoscopy. Review the printed procedure instructions. Pick up your prep supplies. Watch the step-by-step prep video. Review your procedure date, arrival time, and location address. Remind your driver about your procedure date and time. Complete the bowel preparation. Follow your provider's instructions about your medicines. Your prep videos and printed instructions are available in the digital care section of your Duke MyChart. If you have any questions about your procedure or prep, please call Duke GI at 919-684-6437.